Physical and mental health is important for everyone, and yet some of us men can be clueless about our own health or find it really uncomfortable to speak with doctors. Hi, I'm Dinesh Balasingam and welcome to On the Pulse, a new 8-part series on all aspects of health. In today's episode, we'll dive right into a topic that most guys may not want to talk about: male infertility. And if that caused some discomfort, there's a telehealth platform that offers a solution. And finally, mirrors in gyms. Friend or foe? I'm of the age where conversations about getting married and starting a family are becoming a lot more common. We all take it for granted that the kids will come whenever we are ready, but worldwide, infertility rates are rising. Infertility is defined as the inability to naturally conceive a child after 12 months of regular, unprotected intercourse. Sometimes the problem is with the women, other times the men, and often both. There is a lack of accurate and consistent global data, but here in Singapore, male factor infertility accounts for 20 to 40% of all infertility cases, and that number has been on the rise. Dr. Janice Tung is a practicing obstetrician and gynecologist, and over the past 10 years, she has been seeing more cases of male infertility.
In terms of statistics that we see in our IVF center, we see a rise for male infertility from about 5.5% in 2019 to 10.8% in 2020. But more men are coming forward to get their sperm tested. So there's increasing awareness of this issue, and I think men are more conscious of their role in the whole fertility journey. They are less shy about coming forward to get tested.
So what are some of the main causes that leads to male factor infertility?
Male infertility is caused by three main things. The first is a low production of sperm or zero production of sperm. The second thing is blockages that prevent the delivery of the sperm to the woman. And then the third is poor or abnormal sperm function, meaning that the sperm count and concentration may be normal, they may move normally, but they are unable to fertilize the egg.
So, three main reasons. Let's dig deeper into each. The first one is low sperm production. Is that a quantity thing?
To get his partner pregnant, a man must first produce enough sperm. So, too little sperm concentration around the egg leads to no fertilization and no pregnancy. Normal sperm concentration is more than 15 million sperm and above.
Lots of candidates now.
Yes, lots of candidates. Just takes this one, but there must be enough candidates moving forth. In that sense,
Dr. Tung explained that sperm are produced in the testes. At least one must be functioning normally with proper hormone levels to trigger and maintain sperm production. Things can go wrong, however, if there's injury, such as during sports, infection, cancer, or even surgery to the testes. Any of these could lead to the damage to the testes, affecting sperm production. So you mentioned blockages as another cause, and that sounds like a plumbing issue. Is that what it is?
yes, that's right, exactly. So once after the sperm is produced, delicate tubes will transport them and mix them with semen before it's ejaculated through the penis. These tubes are very long and narrow, so anything can happen along the way to block the exit of the sperm. So the sperm is being produced in the testes, but they have nowhere to go. This can happen in certain conditions, so again, injury or infection to the whole area, the scrotum, the testes, as well as some men with certain genetic conditions such as cystic fibrosis. What happens is they can either have a non-existent sperm duct or inflammatory process or fibrosis of the tubes causes blockage, and therefore the sperm can't get out.
The last one, which I didn't quite understand, was abnormal sperm function.
So the sperm count, concentration or movement can be normal, but the sperm doesn't perform its function, which is primarily to fertilize the egg. We can look at the appearance of the sperm in order to tell something about its function, for instance. So this is how a normal healthy sperm should look like. It has a head, it has a tail.
Nice long tail.
Alright, yes, that's right. And you can see here how that differs from some pictures of abnormal looking sperms. The thing about it is that sometimes the sperm may look abnormal, but it can still function. One example you can use is soldiers. They may be good-looking soldiers or bad-looking soldiers, but they can still function as soldiers.
They can still fight the war.
Yes, they can still fight. So similarly, the same with sperm. And again, correspondingly, the converse is true. That means that even if the sperm looks normal, its function can be abnormal. And this may be associated with environmental toxins such as pesticides, exposure to radiation, excessive caffeine usage, or exposure to toxins such as microplastics.
And to find out if your sperms are of A1 quality, you will need a semen analysis. This checks for what Dr. Tung mentioned: concentration of the sperm, movement of the sperm, and shape of the sperm. Dr. Liao Swee Lian is the talent behind the microscope here.
For sperm concentration, based on WHO latest 2021, the minimum sperm concentration is 16 million sperm per mil of semen sample. Now, anything less than that may not have enough sperm to swim towards the egg and fertilize the egg. In early 2000, the minimum guideline set by WHO was 20 million per mil of semen sample.
Right. And is there a reason for this now that they've chosen to reduce it?
It's a global phenomena whereby over decades, it seems men having the sperm count dropping every 10 years.
More research will be needed to pinpoint what's causing the global sperm count drop, but according to Dr. Liao, it is likely due to environmental and lifestyle changes, and sperm concentration may not be the only factor that's affected. So we've talked about concentration. How about motility or movement of the sperm?
Movement of sperm is very important because it enables the sperm to swim towards the egg and fertilize the egg. Now, the sperm has to swim from the vagina, through the cervix, into the uterus, and through the fallopian tube to meet the egg and fertilize the egg. So it's a very long journey, and the sperm have to compete among themselves in a marathon race. Imagine yourself to be a swimmer, swimming from Singapore to KL.
That sounds tiring.
Yes. If it takes too long, the egg will be getting too old, and fertilization may not happen. Okay, let me show you the concentration as well as the motility of the sperm.
Okay.
All right. Now, this sample shows you very good concentration, very good count. This sperm sample is estimated about 90 million sperm per mil.
And looking very active as well.
And very active and it's fast moving. This shows that the fertility health is okay, it's good. Yeah? Okay, let me show you this sample here. Now, this one shows you that it's very low sperm count, whereby you see a lot of immotile sperm or poor movement.
And very sparse compared to
very
the
sparse.
sample
Exactly. So in this case, this sperm will have difficulty fertilizing the egg.
So Dr. Liao, in the previous two samples, we saw examples of concentration and motility. Now we're looking at morphology or shape, which to the untrained eye like me, it's a little bit harder to tell them apart.
Okay, now first of all, the sperm is made up of the sperm head that contains the male DNA, and the neck gives energy to the sperm, and the tails that help the sperm to swim towards the egg. Now, normal sperm can swim very fast, it's like a torpedo. Now what you can see here is that this is how a normal sperm should look like. This one also. And then you have a coiled tail sperm, definitely is immotile, can't swim. And you have a bent neck, and this sperm has difficulty swimming forward. You lose the race to fertilize the egg.
It was eye-opening to learn so much about something I never really gave much thought to. But now, it is time to take an interest and take some protective action. What are some things that us as men can do to ensure a healthier sperm?
Okay, first thing is we should keep ourselves healthy. So we should exercise more rather than sitting down. Because if you are obese, overweight, that overall affect not only the general health and also the health of the sperm. Even exercising, I see more men cycling every morning for about 1 to 2 hours. Imagine that growing area is heated up. That can increase the DNA damage. Secondly, make sure that you have enough rest, good quality rest. Yeah. Thirdly, take some supplements because we may think that we eat enough, but there's some micronutrients may be lacking. In terms of supplements, you can take zinc, selenium, vitamin C, vitamin E, coenzyme Q10. Now, the vitamin E, vitamin C, and coenzyme Q10 are potent antioxidants. So they help to improve or the quality of the sperm DNA. Stop smoking if possible, consume less alcohol, and also processed food.
What a day. I've certainly learned lots from Dr. Tong and Dr. Liao, and I'll be putting into practice some of those lifestyle tips, not only for my sperm health, but my overall health.
Up next, something to help those with sensitive health issues.
Erectile dysfunction. Got your attention, didn't I? Erectile dysfunction, or ED, just isn't something we talk about out loud. But while many of us may make jokes about men who can't perform in the bedroom, or what these little blue pills can do for you, it is no laughing matter for those who suffer from ED. And it is far more common than we think.
A population study published in 2003 estimated that 1 in 2 Singaporean men would have erectile dysfunction at some point in their lifetime. Erectile dysfunction can happen for many reasons. It can be related to health issues like diabetes or heart disease. Or it could happen for a specific period due to stress, fatigue, short-term medication, even lifestyle changes. Sean Lowe had a brush with what he thought was erectile dysfunction a few years ago. While disturbing, something positive came out of that experience. NOAH, a digital health clinic dedicated to men.
We tackle men's health conditions such as erectile dysfunction, premature ejaculation, hair loss, and mental health. Conditions that men often find it hard to talk about. So we really started back in 2020, and it really came from, there's no real easy way to put this, but there was just ones that I didn't really get as hard as I thought I would. And I thought I had ED, right? And I kind of did what every young man would do at that age, which is to ask Dr. Google. I went down this whole rabbit hole. It wasn't until I asked a doctor friend of mine that I found out that actually what I experienced wasn't ED, but it was just stress, fatigue. It kind of causes you to experience symptoms of ED from time to time.
So he helped you put those pieces together.
Exactly, right? I didn't manage to make the link on my own. And it kind of struck me at that point that as men, how little we knew about ourselves. So for us, we wanted to go about setting up a really discreet and affordable way for men to seek treatment for these sensitive conditions.
So I'm guessing discretion is also a reason you didn't seek help in person, going to a doctor the traditional way as one
Yes.
would.
Even if I had ED back then, and the stigma that's attached to the conditions, there was no way that I would have seen a doctor. It's just so embarrassing, and how do you even begin the conversation? So embarrassment was a huge factor for me, and second was cost. Right? Because when you look at the treatments traditionally, they're really expensive, and that kind of put off for me. And the last one is just the inconvenience of actually going down to see a doctor. And so we want to create a platform where it's easy for people to take care of their health all from the comfort of their own home.
So we've spoken about erectile dysfunction, but what else can I use NOAH for?
So beyond ED, we treat premature ejaculation. We also tackle hair loss, male balding. We also tackle weight loss, especially during the pandemic. Insomnia is another one. There's a growing problem in Singapore, as well as acne, smoking cessation, and also mental health. Right? Because oftentimes men find it really tough to talk about their mental health issues, right?
Some of these problems are not things that men speak freely about. So getting men to be vulnerable is a big challenge. And how is NOAH tackling that?
Well, it really starts with the brand. What we want to do is to normalize conversations around men's health. Right? We want to make it easy for men to approach these subjects. We want to create a safe space for them to ask even really basic questions. Right? Even sometimes the questions could be just, if I want to see a doctor, do I need to take a picture of my penis? Right? It's as simple as that, right? Where they can ask these questions without feeling judged or shamed. Right? And that's what we want to do with our channels. For us, it was really important as we outreach to create a brand that really speaks to them, right? Which is why our brand is interlaced with humor and wit. Because at the end of the day, we find that humor kind of disarms and makes it easy to have conversations. And so some of our ads that you see even on socials, could be like a line like, "In NOAH we trust." Just really simple liners that we kind of put out.
But effective.
Yeah, but effective, yes. And we really get really good response, right? In fact, actually 70% of our patients getting treatment for the first time. Right, so we really are unlocking a whole new patient pool who have never gotten treatment if not for what we do.
But realistically, are things like erectile dysfunction and premature ejaculation things that you can address without an in-person examination?
Yes, NOAA is a really good first step for patients who are sometimes experiencing these symptoms for the very first time. Right? It could be due to a chronic condition that they're suffering from, or a new medication that they started taking, right, which causes a sudden onset of ED. Right? So for us, in the patient journey, it really just starts with the medical evaluation. And that evaluation filters out patients who are not eligible. It sometimes could be due to pre-existing medical conditions or current prescriptions that they have. The patient journey doesn't stop there. And we actually refer them out to our urologist on our panel for an in-person visit.
To get a better idea of how the platform works, Sean gave me a demonstration.
As part of the medical evaluation, we ask a number of questions, as you can see. We cover a range of topics such as their lifestyle habits, their medical history, and their current medical condition as well. And afterwards, they'll check out and then they'll book a consult with our doctor. Our doctors are specially vetted and selected. They're all specializing in andrology and hair loss, which kind of give our patients a lot of confidence. Upon approval of the prescription, we deliver the medication to them within hours. At the 6-month mark, we offer free follow-up consultations with our doctors as well to ensure that our patients are in the best health conditions as possible.
And women haven't been left out either. At the end of 2020, Zoe, a telehealth service for women, was launched.
Our mission with Zoe is to really cater for women across different fertility cycles. We're starting off with sexual health. We have our pregnancy test kit. We have our ovulation kits. We also have contraceptives and emergency contraceptives. With fertility, we have prenatal supplements that we formulate with our gynecologists. We have a hormone test kit. And in addition, with the third category that we really tackle is wellness. Right? So we look at mental health. Our therapies provide prenatal consults for women, right? Because sometimes the prenatal journey can be difficult, right? And we also do sleep, hair loss, as well as acne, right, for skin.
So it seems like you got your hands full, but I gotta ask, what's next for Noah and Zoe?
With NOAA, we're moving more towards chronic conditions like diabetes, high blood pressure, high cholesterol. We really want to solve that well for our patients. For Zoe, we're continuing our mission to be that partner for women across different stages of their lives. We're moving more towards pregnancy, postpartum, and menopausal as well, where oftentimes women in that age group are often overlooked.
Telehealth isn't a new thing, but it's good to know that if you have a problem you might be embarrassed about, you can consult a doctor from the comfort of your own home.
Up next, I find out if mirrors in the gym are our friend or foe.
Have you ever watched yourself in the mirror while working out at the gym? Chances are your answer is yes. But is that even something we should be doing? Now, I'm kind of new to this whole working out at the gym thing, so I'm going to ask the expert.
Dr. Arun Jayaraj is a medical doctor turned personal fitness coach. And today, he'll be answering my questions.
So Dr. Arun, we're here in the gym, which feels like your second home. And the one thing I noticed is there are a lot of mirrors around us. How is that helpful to people when working out?
Well, firstly, it's really great for alignment and our form to actually ensure that we're doing our exercises correctly. Things like light weights, yoga, and stretching. It allows us to ensure that our legs and our arms are in the right positions. The mirror does help you adjust and make sure you're effective and also reduces injury. The mirror can also be great motivation when you look right into it. It can also be helpful for those people who have gone through a transformation to actually feel better about themselves. In a way, it reminds you of how much you've done over the last few months and how much more you can achieve. So for those people, the mirror is a great validation and self-assurance of that journey.
But for someone like me who's just beginning their fitness journey, it could be a little bit discouraging to be looking in the mirror while working out.
Absolutely, it can be a double-edged sword. So let's say you're that type of person that may not feel too comfortable or you don't love how you look in the gym. It might not be useful for you to look right into the mirror, and it might be better for you to look away. There might also be another group of people that feel a little more insecure and lose focus by looking into the mirror because they may feel that there are other people judging them as well. So for these people, it's better to also be away from the mirror. But as you go heavier and you start lifting heavier weights with bigger equipment, when you look at the mirror and look at yourself, you may lose focus. It's probably better for you to look away from the mirror and focus on one spot. to ensure stability and also reduce the chances of injury.
But if I still wanted to exercise efficiently, do I really need the mirror, or are there alternatives that I could use?
No, you definitely don't need the mirror. Once you've understood your form and alignment and you start going heavier, you don't need the mirror. But alternatively, you could put your phone down and record yourself. That way you can look at your form later on, and you can also compare it to experts online.
And that's a great way to track your progress.
Exactly. And alternatively, you could have someone more experienced around you, a gym buddy, that can watch your form and also help your lifts as well. Dinesh, today we'll be doing a deadlift to show you a little bit about what I was talking about earlier.
Okay.
But instead of a heavier barbell, we'll be using a lighter pole.
Good news to me.
So put your arms to the side
Okay.
and slowly lean forward to do the deadlift.
Okay.
And as you can notice yourself, you're looking into the mirror,
Yes.
which means that your neck is less stable because it's bent. What we really want is for your head, your back, and your tailbone to be neutrally aligned.
And so would that be just looking down at a single spot?
Well, you start looking down, but I want you to slowly come up and keep your neck aligned to your back.
Okay.
So if you try that again, good, and then come back up. Do you feel that your neck is a lot more stable now?
I can actually.
So by doing that, as you get heavier with a heavier barbell, you reduce your chances of injury and also be a lot more effective with your deadlift as well. But for single joint movements like this, the mirror is a great way for you to check your form and alignment. So if you're doing a dumbbell curl like this, and you're bringing it up and down, and you can look at yourself and see, are your arms and your joints aligned? And yours are. And that way, you might be too far forward, or you might be too far back, or even going out to the side. The mirror helps you just understand.
Adjust that.
But also, in movements like this where you don't need to use your neck or your neck is not involved, it's not too much of a risk as opposed to the deadlift and other bigger movements.
So just like any other equipment at the gym, the mirror is just another tool for us to deploy. When used properly and at the right time, it can help us improve. But when used wrongly, it can lead to problems. And that's something I'm going to remember the next time I'm faced with a mirror at the gym.